Yeah, osteoporosis is a condition that causes bones to become weak and brittle. Here with some tips on maintaining healthy bones is Dr. Roz. Hi, Dr. Roz.
Hello.
Who's at risk?
Well, it's common in men and women, but women are 5 times more likely to develop osteoporosis than men.
Really?
And it's the menopausal woman who's at greater risk. Yeah. It's recommended that we start screening for osteoporosis at 65, but we do that earlier if there's risk factors.
So how can you maintain good bones?
And it's very, very important.
Yeah.
You want to maintain good bones. You don't want to be in the treatment. It's all about prevention. It's all about prevention. And you do that with weight-bearing exercise. So weight-bearing exercise is like walking, dancing, golfing, yoga. That's awesome for healthy bones. Taking in adequate amounts of calcium and vitamin D as well.
Estrogen?
Estrogen is good for prevention, not treatment of the disease, but for prevention, absolutely. So,
DEXA scan, what is that?
the DEXA scan, so that's how we screen to look at the bone integrity. Are the bones weakening? And before you actually get to osteoporosis, there's something called osteopenia. And so if you have a DEXA scan, and that's where you find your T-score. Everybody who's menopausal should know their T-score. And that's your bone health score. And, but with osteopenia, that's the weakening of the bone, the trabeculae starts to get weakened. So.
And we're looking at pictures of healthy bones and weakening bones as well.
Yeah.
Yeah. What are there things that we do that
Puts her at risk.
Yeah, puts us more at risk. Yeah,
things
exactly.
that you do, it's all about prevention. So you're not taking in adequate amounts of calcium and vitamin D, as I said, and doing the weight-bearing exercise. But other things that put you at risk for having weakened bones is alcohol consumption, smoking is a great risk factor as well. Chronic steroids, if you're on chronic steroids for some condition, that certainly puts you at risk also for having weak bones. And it's so critical, it's so important to have healthy bones. We don't often think of our bones,
right?
But it's very important because if you break a hip, having hip surgery, not good, particularly the older woman who may slip and fall because her bones are so weak and brittle. So it's all about prevention. And if we start preparing for that now, so that when we're older, you know, if you want to be 75 and going down a hill in a wheelbarrow, you got to take care of your bones now. You want to be in your 70s running for president. You got to be healthy now.
And if I had to guess, many patients may not know they have it until they break a hip or break a bone.
Yeah, but there are some signs that we can see. You see the older woman who's bent over, have kyphosis in her back. You know, that's a sign of osteoporosis. You don't want to get there. And so, again, and it's fun things that you can do. Exercising, you know, yoga, dancing, golfing. I don't golf, but, you know, there are some things that you can do, and it's all about prevention. That's the key.
Exactly, and going to your doctor and talking and having a good conversation as well.
And that DEXA scan, again, that T-score, it's recommended that you have a DEXA scan at age 65, and it's every 2 years, but certainly there are times where a DEXA scan may be warranted prior to age 65 if you have those risk factors.
And if we have more questions for you, how can we find you?
drrozmd.com is my website.
There's your information and your phone number as well. Thank you so much.
Great, thank you.